Staggering new research showing skyrocketing high blood pressure rates among our youngest. High blood pressure in children and teenagers nearly doubled in the last 20 years. And it's being blamed on poor diet and inactivity. Doctors say hypertension can lead to a long list of health issues, including cardiovascular and kidney diseases. Joining me now is medical expert and nephrologist Dr. Frita Fisher. Dr. Frita, good morning. Welcome. Nice to see you again.
Good morning.
This is concerning. Research was conducted. This is a large sample. It was conducted across 21 countries, 400,000 children. Here in the U.S., the obesity rates far exceeded the rest of the world. What are we doing that's causing such a significant increase, especially comparatively to other nations?
Oh, my goodness. And actually, there was a time when the United States was far ahead. And now, sadly, it looks like the other nations have caught up to us as far as high blood pressure, largely due to obesity and foods that are ultra processed, an unhealthy diet. In addition, kids are getting way too much screen time. They're attached to these video games. They're not moving their bodies. All of these things increase their risk for living with obesity. And we know that 1 in 5 children with obesity has hypertension. This is 8 times higher than children with healthy weights. And so it's largely lifestyle.
8 times higher. I'm looking at the ages here. Research indicated high blood pressure peaked by 14 years old, especially among young boys. What does that data tell you, Doc?
It tells you that even though, like when I was a child, we were running around outside till the street lights went off. Now children are sitting down, looking at their smartphones and eating ultra processed foods. It tells us that there's really a place for education. And what's really scary is that 9% of the children in the study had masked hypertension, meaning even if their blood pressure was normal in the doctor's office, it was actually high at home. And so it's really an overwhelming problem, but we do have solutions.
What do you tell your patients when it comes to establishing healthy habits at a young age and the solutions that you mentioned?
I tell them to make sure that they don't shame. So parents should not shame children, but they should introduce health as a family lifestyle. Go out and play kickball as a family. Eat healthy foods. Don't single out the child who has high blood pressure or the child who's living with obesity. Everyone should be eating foods that are mostly fruits, vegetables, lean proteins. If you eat meat, white meat of the chicken with no skin, fish like salmon, things of that nature. We also talk about limiting screen time. And parents, even though we have so many things to do, we oftentimes need to have some type of a parental module so that our kids aren't just sitting there looking at the screens. Make exercise fun. Make your kids go to do, team sports, activities, because high blood pressure is a leading cause of heart disease, strokes, and it's the #2 reason for dialysis. It's the second cause of people ending up in my dialysis unit. And so it's really important that we get a hold of this issue, because this study was not in adults, it was in children less than 19 years of age.
And like I mentioned, a huge sample here. I love that you tell parents not to shame their kids. I have less than a minute, but what do parents tell you? Do they get defensive, or do they want to help? What do they want to do?
Parents absolutely want to help, and they mostly feel guilty, and they feel like it's just a problem that they can solve on their own. But really, it's a community effort. As this study shows us, where they looked at over 96 studies, and as you mentioned, across the country, 21 countries, this is not a problem that's just for one parent or one bad parent. It happens to everyone. So they feel shame. They need to look to community, consult with their doctors, consult with registered dietitians, and make healthy choices one step at a time.
You're not a bad parent, and you're not making bad choices. This is just improve it with the research that we're seeing. Dr. Frita, thank you so much.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.